Every second brings a fresh beginning, every hour holds a new promise. Every day is what you choose to make it. Good evening to one and all present here. We shall begin this occasion by the blessing of our Lord. I welcome my dear faculty members for the prayer song. Welcome the gathering.
The respected dignitaries on the dais, the faculty members, and my dear students who are watching us online. I wish you all a very good evening to you all. It's my pleasure to welcome you all for this formal inauguration of St. Joseph's Nursing Institution's academic year 2020-2021. Today, we are privileged to have Most Reverend Dr. K. William, the Bishop of Mysore Diocese and the Chairman of St. Joseph's Nursing Institutions as the President of this function. Dear Lordship, we are blessed to have you amidst us. You are our mentor, guide, and the source of inspiration. We are very hopeful that under your able leadership, this institution will flourish and become a landmark in the field of nursing education. On behalf of all gathered here and watching online, I extend a warm welcome to you, dear Lordship. We have Monsignor C. Rayappa, Vicar General of the Diocese of Mysore. Dear Monsignor, we are very grateful to you for accepting our kind invitation and for having graced this occasion. Welcome, dear Monsignor. Monsignor Leslie Morris is also present amidst us. Monsignor Leslie, as we know, is a dynamic person and an able administrator, especially in the field of education. He is our guide and a ready helper along with his valuable suggestions. We are happy to have you, dear Monsignor. On behalf of all gathered here, I welcome you, dear Monsignor. Reverend Father Thomas Burrows, the administrator of the nursing institutions, is one who takes care of the day-to-day administrative works of the nursing college. His creative innovations and hard work towards the nursing college is well appreciated. On behalf of all gathered here, I welcome you, dear Father. Mrs. Mamata, the principal of the nursing college, and Sister Lucy, the warden of the nursing college, and all the teaching and non-teaching staff. We are all proud that you are our proud Josephites who execute all the academic works in a more dedicated way. They are present here. On behalf of all gathered here, I welcome you all for this gathering. A special welcome to all my dear students. I know you are all missing your presence here, but still you have struggled to join us online witnessing this program. We too are missing you, dear students, but hope to meet you all very soon. On behalf of all gathered here, I welcome you, dear students, and a special cordial welcome to our new batch students to our college. Welcome, dear students. Wish you all the best for your new academic year. Thank you, one and all.
Thank you, dear Father, for your warm welcome. May I request Reverend Monsignor Leslie Morris for the inaugural address.
My Lord Bishop, Monsignor C. Rayappa, the Vicar General, Father Manuel, the Director, Father Roxanne Thomas Burrows, the Administrator, Miss Mamata, the Principal, Sister Lucy, the Warden, the faculty members who are all present here, and my dear students. Probably it's for the first time in the history of St. Joseph's College of Nursing and School of Nursing. In 10 years, we are having an online inauguration. It sounds a little odd, but then we have no option, and you are used to the online classes which have been going on for more than a month or so now. This is a special year for you. 1920 is a special year for St. Joseph's College of Nursing. We started way back in 2011 with a small group of students, and today we have a big number. 6 batches have gone out, and those of you who are in the 4th year are the 7th batch. Those who have joined this year for BSc Nursing, you will be the 10th batch of this college. For GNM, the first batch is in the final year now. Nursing, especially during the last 8-9 months or almost a year, has hit the headlines the world over, not only in India, everywhere, even in advanced countries. They are called the frontline warriors. There are many frontline warriors. There are health workers who go to communities. There are doctors who take care of them. But the real frontline warriors who directly handle the COVID patients are the nurses, risking their own life with all the protective gear that you have. This is what the nursing is, and everywhere people feel how nice it would have been if we had more nurses. And all over the world, there's an acute shortage of nursing. It is in that view that the choice you have made to join the nursing profession, those of you who have already reached the 4th year, those who have just begun, even the GNM students, I think it's something very apt, and the world requires this. Nursing, is not merely just doling out some medicine, administrating some medicine, or giving some injections. It's much more than that. It's a kind of a life experience, because unlike the engineers or unlike the other workers, or for that matter even teachers who deal indirectly with human beings. The nursing students, or the nurses, once you get trained, are people who are directly dealing with human beings, and it's not any human being, human beings who need your help the most. Because when we fall sick, we become really dependent on others. Sometimes, and especially in the present COVID situation, even the close ones, the closest relatives cannot be close to us, by our side, bedside. It is the nurses who have to really reach out to the patients, give them the encouragement, give them the courage, give them the strength, bring about a kind of a positive outlook in them. And that's why the nursing profession has become something which is very, very important. And we are happy St. Joseph's Nursing College, which you have started, is now improving. And for the first time this year, the 7th batch of students, the 10th batch of students, which is just joined now, we will have the full strength of 60 students. What we do in St. Joseph's College of Nursing is, I want to make it very clear to you, and I know those of you are already in the 2nd year, 3rd year or the 4th year, you do know St. Joseph's College of Nursing is different from other colleges. The other nursing colleges probably will have some focus or other, maybe academic excellence, or maybe trying to get them the best training possible. What we do in St. Joseph's College of Nursing is train you not only as nurses, not only give you the skills that you require for this medical profession, we train you as a whole person. Because to be a nurse requires really a lot of strength, inner strength. The world over, you must have been reading articles, we find the most stressed out group today is the nurses. Sometimes those who are dealing with COVID patients, they can't even go home. They can't even meet their children. They can't even meet their old parents. They are completely dedicated, and they go through a lot of stress. They need a lot of psychological help. They need a lot of counseling to keep their to keep their balance, but at the same time not lose sight of the profession they have. I'm sure we wish we would have had you here in the campus to begin the regular classes, but unfortunately we cannot have those classes. Hopefully very soon we will have them. You have been having online classes, but mostly in theoretical classes, and for nursing what you learn theoretically is very, very of the examination, but what you require is hands-on experience by the bedside of the patients, being in probably an operation theatre or an ICU or a maternity ward or wherever it is, where you will have to have that experience to hone the skills so that you will become nurses who will be doing your work with commitment. We wish that so very soon we will have that situation. But for the present, let's be satisfied with whatever hardships that we have to face because of this online situation. Definitely sooner or later we will come together, and our teachers are all committed. They're all waiting. The whole administration, the management is waiting to have you here because we want to train you, and especially those who are in the final year. The whole society is waiting for you. The society, government, I hope you know already, has announced those who are already in the 4th year, even though they have not completed their exam, they can go and work because there is so much of demand of nurses. We wish that very soon you will be with us. And the St. Joseph's College of Nursing, we are proud that we are beginning this academic year 2020-21, and very soon probably we will have all the things in place so that everything will go well. But for the present, prepare yourselves. Whatever possible, you try to learn through whatever you have got through online classes. I know practical experience will be missing, but if it's possible through books or through videos or through internet, if you can get some skills, try to get them. I wish you all the best, especially the first year GNM students and the first year BSc nursing students. A warm welcome to you to St. Joseph's College of Nursing and School of Nursing. We will meet together. Till that time, I wish you all the best. Thank you.
Thank you, dear Monsignor, for your beautiful words. May I request our Reverend Father Dr. K.A. William to render the presidential address.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Reverend Monsignor Rayappa, the Vicar General of our Diocese, Reverend Monsignor Leslie Morris, the Episcopal Vicar for Education and Medical Ministries in the Diocese, Reverend Father Manuel Manoj D'Souza, the Director, Reverend Father Roxanne Thomas Burrows, the Administrator of the nursing institutions, the principal, the warden, and all the staff, teaching and non-teaching, and my dear students. It's very interesting as we are able to interact, come in contact with you through this live streaming program. At the outset, as we have the inauguration program for this academic year, I welcome you all very happily, warmly to the larger family of St. Joseph's in Mysore, especially the first year students, both BSc Nursing and GNM. Well, Monsignor Leslie in his keynote address has beautifully given you the concept of the choice what you have made to be nurses. Honestly speaking, this is one of the best and the noblest profession, and we have to congratulate you for choosing this particular profession to be nurses tomorrow. Today, more than anything, human beings need health care. Healthcare, and very especially during this COVID-19 situation. The whole humanity is longing to have better health. And we know how limited we are when we do not have 100% solution until the vaccine comes for our help. And you as nurses, you are going to serve this humanity. As I said, the most wanted care is the health care. It's not just the academics that is important, where you study in our institution. But there is something more that you have to grow along with. It's not just the classroom, maybe today online, and once we are out of this situation, you will come to Mysore, you will sit in the classrooms, you will be listening to the lectures and in the practical classes. Good, but not sufficient. There is something more that you have to inculcate and learn along with. That is the values, the human values, which will make the nursing profession more tangible, more meaningful, significant, relevant. What are these human values? As nurses, you may have to have a great heart to accept everyone, the poorest, the most, the patient who is suffering most. the patient who has lost hope, the patient who is struggling to cope up and come up back to his normalcy. The great heart you need to have to accept everyone as they are. To have better patience, to bear with. Maybe some are irritating, maybe some people may not understand, maybe immediately they want things to happen. And you may have to have patience. You may have to have that love for all. Because you love your profession, and there's a great call to you to love all the patients, their attenders, and the ones who are working with you. Face every difficult situations. And at last, I tell you, you will have the joy, that satisfaction that you are doing something great to the humanity. So I would say this St. Joseph's College of Nursing or the School of Nursing gives the necessary education not only to the head level but also to the heart level. Head level, all the academics, both theoretical, also the practicals, but then at the heart level, where you and your personality, you grow with, you gain with, and you get acquainted with the realities of life, where your profession becomes very successful. So, just now as you are in your places and you are studying through the online classes, just take the subject not just to your mind but to your heart also. There is a call to journey from your heart level, from your mind level to your heart level, wherein you will learn the academics, you will learn the theoretics, and also you will learn the human values. I am really proud of St. Joseph's Nursing Institutions, the principal, the staff, the sister who takes care of the students, and the management, the Episcopal Vicar, the director, and the administrator. I am happy to tell you they are doing their best. They are doing their best so that you will get what is best for your tomorrow. At this juncture, I remember gratefully Reverend Father George Martis, who was both the director and the administrator for past several years, who initiated along with the diocese this institution, and we are happy that he has established this college and the school. And now the new team, a team of fathers and the staff are working together as a family, all for you, all for good of you. I only wish all the best to the staff and more to you, my dear students. And this season of October, the season of Dasara we call. Sorry to say you have missed the wonderful season in Mysore. You would have been happy to visit the beautiful city of Mysore during these days. If you were to be here, and you would have enjoyed the Mysore climate, the beautiful decorations, the Dasara processions, the palace and whatnot. Anyway, yet you have wonderful chances to come back as early as possible to cherish and experience the beautiful city of Mysore. Wish you all the best, study well, make use of all the facilities that the college provides to you, and work hard so that you will truly fulfill what you and your parents and we dream for you and the humanity. A word to your parents. Thank you for choosing our institution. Thank you for sending your children to our institution. We ensure all care and all quality based education to your students, to your children. And your children are our students. I only request all the parents to cooperate with the management as and when they request your cooperation. As and when they contact you for your cooperation, coordination, please do it. Because this COVID-19 situation has brought in difficulties to all, you and equally to us. So your cooperation with regard to everything, when it comes to the education of your child, when it comes to the directions to be followed from the management, please cooperate, and you and your cooperation will enable our management, our staff to do much more better for the good of your children. Our blessings and our best wishes. Thank you.
Thank you, Your Lordship, for the inspiring words. Now we shall have the bird eye view of our institution by the principal, followed by our faculty members.
Hello dear students, myself Mrs. Mamata Ji, Principal, St. Joseph's Nursing Institutions. I'm glad that you have chosen nursing institutions, and St. Joseph's is your Mamata Ji. Let's give you all a book. To Rajiv Gandhi University of Health Sciences, which offers BSc Nursing and GNM courses. Institution started year 2011, inaugurated on 1st September by His Excellency the Most Reverend Thomas Anthony Varapilli, former Bishop of Mysore. And GNM Nursing was started in the year 2018. Institution is equipped with solid infrastructure and provide education as per norms, which is complemented by qualified and experienced faculty in order to bring out students with high caliber of character, knowledge and efficiency. The institution expects a high degree of discipline from the students. St. Joseph's Hospital. So this is the parent hospital of the college, which is under the patronage of St. Joseph's Hospital Trust. Started in the year 2008 with a provision for 150 beds. A hospital provides quality healthcare at an affordable cost for the people. It provides an excellent opportunity for complemented the theoretical knowledge of students by the way of exposure to modern medical gadgets, interactions with the doctors, staff nurses and the patients. The graduates of the program are thoroughly prepared scientifically and technically to take up the positions in hospitals, communities and institutional nursing services. We have the philosophy for the institution. We have a mission. College believes in providing nursing education based and built on scientific principles, sound educational theory and clinically sound practice in order to prepare clinically excellent, professionally qualified nurses who will work efficiently in all healthcare settings to meet the health needs of society. We have the vision like this: to empower the youth who seek to attain fulfillment in nursing profession blended with human and ethical values. The objectives of our institution. The first objective goes like this: acquire knowledge of theory and principles of nursing and allied subjects which are required for comprehensive nursing practice. The second objective goes like this: care of patients with the spirit of love and service, regardless of their caste, creed or color. The third objective goes like this: develop skills in applying scientific principles and knowledge in rendering health services in the hospital and the communities. The fourth objective goes like this: acquire skills in identifying health needs of the community and provided comprehensive community health nursing services. The fifth point goes like this: training students in an efficient and effective way for the overall development of their personality and also a competent professional nurses. The sixth objective of an institution goes like this, that is, acquire skills in teaching, research and evidence-based nursing practice. Now, what is the scope of nursing that you have chosen nursing as a profession? Yeah, you know what is nursing is. Nursing is a profession with its compassion, care and love. Nursing from its inception, it focused on caring sick and needy. Globally, there is nurses increased demand due to many health issues, especially during pandemic situations. Nursing is a great profession to be considered as you directly influence the health and well-being of the people. The second scope what you have for nursing is, nurses will have a range of career which is rolled in one. As you develop, you can diversify and specialize. The third scope goes like this: nurses work in a large varieties of specialities where they can independently work and as a part of team to assess, plan, implement and evaluate the care. The next scope goes like this: they can work in settings like hospital, nursing homes, clinics and health departments of orphanages, old age homes, military like army, navy, air force and marines, community settings, that is like school nurse, health visitors, industrial houses and factories, railways and public sectors, medical departments, training institutes as educators, home care, palliative care, hospice, public health agencies, ambulatory care centers, extended care centers offices, like corporations, health related industries, occupational settings, mental health services, private healthcare providers as, for example, like practitioners, prison nurse who are working in the jails, correctional, de-addiction centers, research promoting advancements in healthcare and health promotion practices. They have numerous scopes. We can work in any of these ways. The next scopes, like they can diversify into different areas of nursing practice like operating rooms, critical care and emergency departments, women health and mental health, and there are many subspecialty areas such as sports injuries, nursing, cancer nursing care or cardiac care, lot of areas like newborn intensive care. These are the other areas where you work in hospitals. The next scope goes like this: the nurses may choose to work in one permanent setting or many take short-term assignments as a travel nurse to fulfill temporary projects for nursing staff internationally. They can even serve in key government and elected positions, become a nurse practitioners, clinical nurse specialist, nurse educators, researchers or nurse managers and so on and so on and so on. As a nurse, the sky is the limit. I do congratulate all dear students for choosing nursing as a profession and welcome to the family of Josephites. Thank you.
Good morning to all. I am Vaikom Reena Devi, Associate Professor in St. Joseph's Nursing Institution, Mysuru. Dear students, a good nurse contributes to the success and stability of the healthcare institution and to the mental and physical well-being of their patient. Some qualities of the good nurses are such as caring, communicative, responsible, observant, team player, flexible, etc. Etiquette is a code of good manners that a nurse should follow You as a nurse should be courteous to all. You be gentle and polite in your talk. Greet your seniors, co-workers, your patients, etc. with appropriate words and according to the time of the day. You should address the seniors with proper title, for example, sir, madam, sister, Mr., miss, etc. You should stand up when people of the higher rank enter to your room. Keep your dress neat and tidy, be punctual, say thank you when someone is doing a favor for you, keep eye contact and sit face to face when listening to someone. Dear students, nurse is an important member of the health team member. For the smooth functioning and to maintain a good interpersonal relationship, a nurse should follow these essential good manners. Congratulations to all. Thank you.
Hello everyone. Myself Mr. Madhav Prasad NS, Assistant Professor and HOD of Psychiatric Nursing Department. Congratulations for choosing noble profession and thank you for joining St. Joseph College of Nursing. Now I would like to brief about categories of nursing. First we will have a look on categories of nursing based on education level. First we have A&M, that is auxiliary nurse and midwife who works at grassroots level of healthcare. Next we have GNM, that is a general nursing and midwifery, it is a 3 years diploma course. We have BSc nursing 4 years course which you are stepping now. MSc nursing, it is a 2 years course offered in 5 specialties, that is medical surgical nursing, psychiatric nursing, pediatric nursing, community health nursing, obstetric and gynecology nursing. Next we have MPhil nursing and PhD nursing which is doctorate degree. Nurses can work in different job areas. So, in hospitals they can work as a bedside nurse, operation theatre nurse, pre-operative, post-operative, ICU, dialysis, labor room, pediatric ward, geriatric ward, oncology, palliative care, mental health, de-addiction, emergency, etc. Remember, no wards can function without nurse. Nursing service and job opportunities are not limited to hospital itself. They have opportunities in old age homes, prison, orphanages, school health nurse, industrial nurse, nurse educators as a researcher, independent practitioners and middle level health providers. So, in hospital nurses take different positions like nursing assistants, nursing officers, ward in charges, nursing supervisors, assistant nursing superintendent, nurse managers, nursing director. In educational institutions, you can work in many designations like nursing tutor or clinical instructor, assistant lecturers, lecturer, assistant professor, associate professor, additional professor, professor, vice principal, principal, dean. Now, my question to you is, where you wish to see yourself after some years? Hope you will set your goals to be best nurse and come out with flying colors and spread the essence of our profession throughout the world. Wish you all the best and chase your dreams. Thank you.
Hello everyone, myself Padma, working as an assistant professor in St. Joseph's College of Nursing since 3.5 years, and I have done my specialization in child health nursing, which is about studying the growth and development of the children and which is the important milestones which takes place during the childhood. And welcome to the family of St. Joseph's, and let us move on to the topic called as nursing as a profession. So what do you mean by profession? Profession is nothing but it has got its own body of knowledge, skills, attitude and practice. So I can give you the example of an injection. It takes a fraction of seconds for the nurse to give the injection, but nurse has to have adequate knowledge about the muscles and she has to study how to load the injection, which is the angle she has to instill the injection. So that is about a brief introduction about the profession. So nursing is also called as a noble and a dedicated profession. So all of us might have noticed during this pandemic, so all the healthcare warriors, especially the nurses, were honored and appreciated throughout the world for their tireless and selfless service. So I congratulate all of you are stepping into such a noble and dedicated profession. So let me also explain about the role of nurse. The role of nurse is not just limited to giving care to the patient and following the prescription which is given by the doctor. So the nurse has got a multi-purpose role, which is first thing is a primary caregiver, that is giving care to the patient. patient. Second one is about she act as a health educator by giving education to the patient. So example, a patient of diabetes will be taught by a nurse how to take an insulin injection, what type of the diet he is supposed to take, and what the signs and symptoms of the hypoglycemia. So that is how she act as a health educator. And third one, she act as a coordinator by coordinating with the other health team members. And also she will be a advocate. A nurse also will be a best counselor. So many times you might have witnessed. So whenever you go to hospital with any sort of pain or any suffering or with any diseases, so you might have seen many nurses counseling the patients and comforting them. So finally, the nurses can dispense care, compassion without even a prescription. So I congratulate each one of you and wish you very all the best. Thank you.
I am Mrs. G.T.M. Joseph, Assistant Professor at St. Joseph Nursing Institutions, Mysore. I am the class coordinator for 4th year BSc students and my specialty is MSc Medical Surgical Nursing. Today, I am going to discuss with you the topic hospital admission. That means the first step, how to receive a patient to hospital when you are in clinical settings. On admission, the patients comes to hospital with a lot of tensions, anxieties and worries. So, as a nurse, we should communicate with them politely and provide reassurance to them. Admission means receiving a patient to stay in hospital for observation, investigation, diagnosis, treatment and care. First one, elective admission or planned admission. It refers to scheduled in hospital stay based on decision made by you and your physician requiring specialization in hospital treatment. Example, planned cesarean section. Second is emergency admission. It is a sudden, unplanned and unexpected admission. Example, it is road traffic accidents, heart attack, snake bite, etc. Now let us discuss about the steps of admission. First one, to welcome the patient and establish a positive relationship with the patient and his relative. Greet the patient with a smile and call them by name. Second is to make a trusting relationship with the patient and be friendly and professional. Provide the best services that you can offer. Second, to offer immediate management and care in emergency situations. The nurse should be alert, active and quick in action. Third is to orient the patient about the new environment and services available in the hospital. It includes the working hours and benefits. Example, the availability of casualty services, ICU, operation theatre, lab, pharmacy, CT scan, MRI, etc. Fourth point is to acquire the data of a patient through history collection and physical examination. Here, you have to collect the name of the patient, age, sex, education, medical and surgical history, list of allergic medicines, laboratory reports, insurance coverage, advance payment. Fifth one, to collaborate with the patient in planning and providing patient care. Discuss about the selection of room or ward, medications, invasive procedures, surgeries, cost of treatment, alternative treatment, duration of treatment plan, visiting hours, etc. Sixth and last one is maintenance of records and reports. The nurse should be follow all these steps when the patient gets admitted in the hospital. The hospital stay of a patient should be stressful. So as a nurse, try to provide a happy and comfortable stay. Dear students, congratulations for choosing our institution. Thank you.
Hello dear students, myself Jishi Vijaykumar, Assistant Professor, St. Joseph College of Nursing, Mysore. I am from Community Health Department. I would like to start with a quote by Florence Nightingale. Nursing is an art, and if it is to be made an art, it requires an exclusive devotion as hard as a preparation as any painter's or sculptor's work. It is one of the fine arts and finest of fine arts. Today, I am going to give you a small introduction on the topic called nursing process. The nursing process is an approach for providing nursing care to the clients. The purpose is to provide individualized and efficient patient care through professional and organized method. It also provides scope for critical thinking, which means applying knowledge and our own experiences to identify the patient problems and also providing solutions. So there are 5 phases for nursing process. One is assessment, the other one is diagnosis, planning, implementation, and last one is evaluation. So the first step is assessment. Assessment simply means collecting the complete information regarding the patient. To collect the information, and we have to analyze, and we also have to assess the symptoms and signs of the patient. How we assess the symptoms and signs? We check the laboratory results, diagnostic results, etc. And the next phase, so after assessment, the next phase is diagnosis. This is a key step where we identify what exactly is the problem of the patient. We analyze and interpret all the collected data from the first step, and we see what problems do they have, and also we see what are their responses, like pain or any irritation, like that. So then after this phase, the next phase is planning. The planning is the phase where we plan what to do for the patient, for achieving our goals. If the patient is suffering from pain, what we will plan to reduce the pain. So after the planning, the next stage is implementation. In this phase is where we actually carry out all the things we have planned earlier, and the plan of care will be available for all the healthcare members, and we document it as well. Next, the final step is evaluation, which is a very simple step. Finally, we are evaluating the outcomes, and we assess whether the patient's problems are solved and as we have planned. Thus, the nursing process promotes critical thinking, creativity, problem solving, and decision making skills in clinical practice, also providing care using the nursing process. This increases the quality of care, and in turn increases the level of satisfaction of the individuals who receive care. So finally, I congratulate all of you for choosing the noble profession, and heartily welcome you all to the Josephine family. Thank you.
Good morning, dear students. I, Chandramati Arul, Assistant Lecturer of St. Joseph Nursing Institution, Mysuru. Today, I am going to talk on communication. It is an act to convey meaning from one group to another through the use of mutual understood signs, symbols, and Semitic rules. And there are verbal and non-verbal communication. Verbal communication means by use of words and speech. Non-verbal communication means by touch, eye contact, and facial expression. So the communication is very important for the nurse to understand, to exchange ideas to the client, relatives, doctors, and other members of the health team. Good communication reduces the tension and improves the good relationship, and it helps the nurses to modify her behavior, and also it prevents the disorders in the wards, hospital, and organization. Now we will see the essential of communication. Always put the client first, smile, use calm, welcome voice, show them proper respect by use of Mr. and Mrs. Pay attention to the verbal and non-verbal communication. Sender and receiver should be of same language. She or he should have face-to-face and eye contact to the client and others. Thank you. Welcome to St. Joseph's Nursing Institution.
Good morning, dear students. I am Sister Linda, Assistant Lecturer, St. Joseph's Nursing Institution, Mysore. I am Class Coordinator for first year and second year GNM students. I deal with subjects Fundamentals of Nursing and OBG. I am going to brief you about meeting the needs of the patient. First of all, let me discuss what is a need. In simple terms, need means an essential requirement to be fulfilled which is important or urgent. The best example would be our life. To live, we require certain basic needs. Of course, the important elements, as you know, are air, water, food, shelter, and clothing. These are the fundamental needs of every human being. We can classify the needs into physiological needs which include comfort, sleep, etc. As a nurse, our responsibility is to provide a comfortable environment to the patient when he comes to the hospital. Next, psychological needs. It includes the mental health and stability of the patient. The patient comes to the hospital with lot of anxiety and fear. As a nurse, we have to provide reassurance to the patient. Spiritual needs, which includes dependence on the Almighty. Nutritional needs, which includes need for food for sustenance of the body. Hygienic needs, it includes advising the patient to keep the body clean and the environment clean to protect him from infection and sickness. So, as a nurse, we have to assist the patient in meeting the above needs with love and dedication. Thank you, students, for choosing our institution.
Hello dear students, myself Sayeda Afra, Assistant Lecturer working in St. Joseph Nursing Institution. I am the coordinator for 3rd year GNM Nursing. Dear students, as a professional nurse, we play a major role in caring of the patients from when he admitted to the hospital till he recovers healthier and discharges from the hospital. So we play a major role in caring, in preventing and promoting aspects. So when the patient comes to the hospital, you should make him feel as he is in the home. So you have to take care from and meet the basic needs of the patient, psychological needs, nutrition, special needs as well as the emotional needs. So we play a major role, and in some cases the death becomes fatal. Example, you take the cancerous condition. When the death becomes fatal, the nurse play a major role in the terminal stages of the caring of the patient. So you have to play a major role and give him a peaceful death without any pain. So you have to take care of the person at his end stages, provide him empathy, take care of his emotional needs, psychological and nutritional needs. So you have to support the family, where the family will be dealing with the major responses such as emotional and psychological responses, loss and grief. So the nurse communicates and shows empathy and deals with the loss and stages of grief. So how will you care of a dying patient? So now when the death has occurred, you will take care of the patient, remove the equipments, clean the excessive secretions, blood stain, give a good appearance to the patient without neglecting or ignoring the person. You have to groom him well and clear all the consent and take the signature from the authorities, and with the family members get the consent and hand over the patient's dead body to the relatives. So if it is no relatives are present, you will be sending the dead body to the mortuary with the clearing all the legal issues. So by this I will end up the topic, and I congratulate everybody to joining our institution.
Yes. So these sessions made to understand some things. Here I'm going to end the session.
I congratulate everybody to
Understand nursing profession. And I take this opportunity to welcome you, dear students, to St. Joseph's Nursing Institution family. Nurse, just another word, just to describe a person strong enough to tolerate everything and soft enough to understand everyone. Hope you will be the person to tolerate and understand, and start your step to be the icon of nursing with us. Thank you.
Thank you, my dear colleagues. Now we shall have a short entertainment dance by our students.
मौसम छे अब आओ मेरे पास रह जाओ मेरे साथ प्रेमनिया मौसम छे हो गई रात मन भूलो बदीवार दुनिया मौसम थे अब आओ मेरे पास रह जाओ मेरे साथ बेमनिया मौसम थे मिल जाए मुझको अगर साथ तेरा तो भूलूं मैं सारा जहां चोगाला तारा चबीला तारा रंगीला तारा रंग बेर जुए तारी बात चोगाला तारा ओए चबीला तारा ओए रंगीला तारा रंग बेर जुए तारी बात रे
ఊహలకు దొరకని సొగస ఊపిరిని వదలని గొలుసా నీకు ముడి పడినది తెలుసా మనసున ప్రతి కొసా నీ కనుల మెరుపుల వరస రేపినది వయసున రభస నా చిలిపి కలలకు బహుశా ఇది వెలుగుల దశ
வார்த்தை தேவையில்லை வாழும் காலம் வரை பார்வை பார்வை மொழி பேசவே நேற்று தேவையில்லை நாளை தேவையில்லை இன்று இந்த நொடி போதுமே வேறென்று வித என்று வீழ்த்தூவும் மழை என்ற இதயன்னைவ தோட்டம் பூ பூக்கிறே வாலின்றி போரின்றி வலிக்கின்ற யுத்தம் என்று இதயன்னைவனுக்குள் என வெல்லுதே இதயம் முழுக இருக்கும் இந்த தயக்கம் எங்கு கொண்டு நிறுத்தும் இதை அறிய எங்கு கிடைக்கும் விளக்கம் அது கிடைத்தால் சொல்ல வேண்டும் எனக்கும் முதலிரே മൃദംഗാതിവാദ്യവൃന്ദങ്ങൾ വാനിലുയരുന്നുവോ സ്വർണ്ണ കസ്തൂരി കനക കളഭങ്ങൾ കാറ്റിലുതിരുന്നുവോ അറിയമാൻ പേട പോലെ നീ എന്റെ അരികെ വന്നൊന്നു നിൽക്കുമ്പോൾ മഴയിലാടുന്ന ദേവതാരങ്ങൾ മന്ത്രമേലാപ്പുമേയുമ്പോൾ നീ വനവലാകയായി പാടുന്നു ഇതൊരമരഗന്ധർവയാമം ഇതൊരനക സംഗീത സല്ലാപം അലഞ്ഞൊറിയും ആഷാഢതീരം അതിലമൃദു പെയ്യുമേഴാം യാമം അറിയാതെ അറിയാതെ നീ പവിഴവാർ തിങ്കളറിയാതെ അലയാൻ വാലിയാൻ വായി പ്രണയ തൽപ്പത്തിലമരാൻ
Thank you, dear students. Thank you, dear students. I request our beloved administrator, Reverend Father Thomas Roxon Barros, to propose the vote of thanks.
Give thanks to God all through your life for the wonders that He has done in our life. It is my pleasant duty to propose the vote of thanks on behalf of everyone gathered here, and very especially all those who are watching online this inaugural program. First and foremost, I thank the Almighty God for the blessings that He has showered upon us to have this virtual inaugural program in a meaningful way. I greatly appreciate and thank our Chairman and Bishop, Most Reverend Dr. K. William, for sparing his valuable time to be with us this evening and declaring this academic year open, and for his inspiring words for us all. Thank you, dear Excellency. I thank our dear Monsignor C. Rayappa, the Vicar General of Mysore Diocese, for gracing this event. He is always there to inspire us and support us, very especially our St. Joseph's Nursing Institution. Thank you, dear Monsignor. I take this opportunity to thank our Episcopal Vicar, Reverend Monsignor Leslie Morris, for the inaugural address and always leading us to excellence. Thank you, dear Monsignor. I gratefully thank Reverend Father Manuel D'Souza, the director of our institutions, for his constant and continuous planning and support for the success of this program. Thank you, dear Father. I thank Reverend Sister Lucy, the warden of Girls' Hostel. Thank you, dear sister, for your presence and all the service that you do for us. I take this opportunity to thank our teaching fraternity, especially Mrs. Mamata, the principal and all the staff for the meticulous arrangements made for the success of this program. A special note of thanks to Miss Afra for anchoring. Thank you. I very specially thank Reverend Father Bernard Prakash, Barnes, Director and Manager of St. Philomena's Institution, and Professor Arpert Printo, the PG Director, for giving us this studio for this online program. And I render my special thanks to Mr. Arun George and Mr. Akin for their continuous support for the live streaming, recording and editing works. Thank you, friends. I thank also Mr. Sanjay for the online streaming for this program. I thank the senior students for the beautiful dance, and finally I take this opportunity to welcome and thank the newcomers, and very especially the parents of the newcomers for choosing our institution. Thank you. At last, I thank each and every one of you who are watching this program online, and everyone, thank you, God bless you, be safe and take care.
Thank you, my dear Father. As every end is a new beginning, we wide open our arms to welcome my dear students who are ready to be the family of St. Joseph's Institution. Lastly, I thank everybody for giving me this opportunity. I thank you all.